I have Michelle with me, and we're going to discuss a little bit about your experience as a woman with cancer. But before we get into that, can you share a little bit about your personal experience?
Yeah, for sure. So thanks for having me. It's great to be here. It was the end of 2017, and it was coming up on December. Life was very busy. I am a professional in the investment space, so year end is a busy time of year. And I had just bought a new house with my now husband, then boyfriend, and we also had two 5-year-old daughters at the time. So life was super, super busy. And I started feeling unwell at the end of November. And after my last workout in the gym, I ended up locking a muscle in my hip. And it was pretty excruciating. And I spent many trips back and forth to doctors and the hospital and such. And ultimately, what it led to was a diagnosis of acute promyelocytic leukemia. And unfortunately, because of that back and forth, my prognosis was not great. I had about 24 hours left to live at the time that I was admitted to the cancer center for treatment. Yeah.
And so the time when your hip locked and the time that
hmm
you got your diagnosis, how long was that?
it was really quick. It was about a week and a half.
And
The thing with acute promyelocytic leukemia is that it's very aggressive. So once the onset has occurred, the my understanding is the time to mortality can be anywhere from 7 to 28 days. So time was of the essence.
did you have symptoms before your hip locked?
I mean, I did, but to be honest with you, I was super, super tired. And it was the kind of tired I would have experienced in the first trimester of my pregnancy with my daughter. So I thought it was odd that I was so tired, but I figured, busy life, end of the year, maybe it was just, my system telling me it was time to wind down for the holidays. And that's really all it was for a while. And then I did notice kind of a strange feeling in the middle of my back, and I wouldn't even say that it was pain. It was just more like I just couldn't get comfortable.
Hmm.
Yeah, and it wasn't until after I locked the muscle in my hip that things really spiraled quickly because I had originally gone to the hospital, and they prescribed me a couple of medications, which, made me feel warm and fuzzy and maybe care a little less about the pain I was in, but I couldn't do anything. I couldn't parent, I couldn't drive, I couldn't, and so that prompted me to go to my family doctor. And she asked a couple of questions. There was not really an exam that took place. It was just sort of a couple of questions. And she said, yeah, it's a locked hip. And she prescribed a couple of different medications. And about 24 hours after taking the first dose of those medications, I started bruising. And they were really, if you could imagine going to like a paintball day, right? The way that they kind of splatter, the way the paintballs kind of splatter, that's what the bruises looked like on my body. And I had actually called my doctor back and said, hey, this is happening and I don't really understand why. And they were quite dismissive. They told me, um, if it doesn't improve or it gets worse, call us back. And if you have any other questions about the medication, call the pharmacy. So I didn't really think much of it and continued taking the medication. And the next day, I noticed some more splatter-like bruises on my body. And by the end of that day, my blood vessels had started bursting. Um, and even at that point, I was like, well, I've been to the hospital once. I've called my doctor twice. Nobody seems to be concerned about this. So I guess I'll just go to work tomorrow. And I woke up that morning. It was Friday, December 8th, 2017, and I felt atrocious, atrocious. By that point, I had started hemorrhaging, which, quite frankly, I didn't think much of. I mean, it was unusual, but I didn't really chalk it up to much else than, I was just having a super heavy period. And so I tried to drag my, like I tried to use all of my will and might to get out of bed that morning and get ready for work, and I just honestly couldn't do it. And so but I thought to myself, nobody thinks this is a big deal. So what am I supposed to tell my employer? And so I thought, you know what? I'll call Telehealth Ontario and see what they say. And so that's what I did. And essentially they said, drop what you're doing now and go to the emerge. And I was like, okay, well, that seems like a little, that seems a little extreme. So I said to them, okay, well, I'll get my daughter ready for school and drop her off, and I'll drive myself over to the hospital. And they said, don't drive. We will call you an ambulance if you need one. And I was like, oh, okay, like this is a wild comparison between everything else that I had heard up till that point. And I thought, I get that they need to be overly cautious, but this is a little much. So I did. I got my daughter ready for school and I dropped her off and I drove myself to the hospital. And even when I sat with the triage nurse, and she was asking me to explain the situation, I said, I locked my hip. I started taking this medication. 24 hours after taking it, I started bruising, and then my blood vessel started bursting, and now I'm hemorrhaging. And she said, so, well, the doctor's just going to tell you to stop taking the medication. And I said, well, I've already done that at this point, and this is not stopping. Like it's persisting. So I think there's a bigger problem. And she said, so you're here for a heavy period. And I said, no, I'm here because my body looks like crime scene investigation, and I don't know why.
Yeah,
I
I mean,
said, it was just wild. I said, I called telehealth this morning. I explained to them what's going on. They told me to drop what I was doing and come here. So I'm here. And she said, we call telehealth 1-800 go to emerge around here. And I said, I don't care what you call telehealth. I need to see a doctor, and I need to see a doctor now.
yeah. So there's a couple of things I wanna ask you. First of all, did you have any hip issues prior? Because the hip is a pretty strong joint, and
Yeah.
it's like one of the least likely areas where you're gonna have an injury unless it's like a major, major crash.
Yeah.
So, like, if you present yourself at your doctor or the emergency room or wherever you're going and your hip is locked, my background is in exercise science. And for me,
Hmm.
that would be like, oh, especially in a young woman,
Yeah.
like you're not in menopause, you're not in like where your bone density is, you're going to the gym. So I'm assuming your bone density is pretty high or normal. So like for me, this would have been like the very first like indicator that there's
Yeah.
something else going on here.
Yeah.
And
And
then
sorry,
no,
I
I was
actually
just gonna
have,
say,
yeah.
and then secondly, when you like, regardless of whether you have a heavy period or not, like you don't get bruising on your body. So like I've never heard of anybody hemorrhaging during their menstrual cycle to the point where it's like going down their legs. That just doesn't make
Yeah.
sense.
Yeah. So I actually have always had lower back and hip issues. So originally when they said locked muscle, it didn't ring any alarm bells for me. What rang alarm bells for me was that a week later, the muscle was still locked. That's what did it. And I mean, I'm not a medical professional, so when I went into my doctor and she said, "Yeah, it is a locked muscle," I did think to myself, "Hey, like this has been a while, and I don't think that this is supposed to happen." But I trusted the advice of my doctor. So I mean, yeah, I didn't think it was unusual to begin with, but it didn't take long to start feeling like it was unusual. And then in terms of the the response to my period. Yeah, I mean, I could not, it's funny because when the triage nurse, or the registration nurse finished registering me and I was, waiting to be taken back into a room, it was so severe that I couldn't sit in the waiting room. I had to be in the washroom. And when they came out and called me to come back to a room, I obviously was not immediately ready to do that. So when, I cleaned myself up and I went back to the counter and said, "Hey, I think you just called me." And they were annoyed with me for not being available. It was a surreal experience, just surreal.
Yeah. Do you think, and maybe let me back it up a little bit before I
Mhm.
ask you this question. Do you feel at any point like because you were a woman, you were dismissed?
Absolutely. I
So
would
why do you
say,
why do you feel that?
well, because I mean, I think we've seen that historically in healthcare, right? I mean, when you think about the barbaric procedures that women have to go through without even being offered anesthesia, I mean, uh, I think it would be more unusual to suspect that I would not have been dismissed because I'm a woman, right? And I
Mhm.
think what's even worse is that because I was so used to that, whether it be in healthcare settings or any other setting, I was dismissing myself as well, right?
Yeah,
So, yeah.
that's I think you're totally right. Like we're just dismissing ourselves because I think about, so many times where I'm like really not feeling well and I have like a really high threshold for pain. But there have been times where it was like I I go to the maximum limit before I
Yes.
present myself to an emergency or I go see my doctor because I'm always like I know in the back of my mind I'm going to be dismissed. So it's like what's the point?
Yeah. Do you want to know what's really wild is that so my husband and I had switched financial advisors about 4 weeks before my diagnosis, and I had sat in his office with him and we were going through all of the introductory paperwork and the get to know you stuff. And he asked me if I had life insurance. And I said, I have whatever's offered through my employer. And he said, "Well, you just bought a house and you have kids and a spouse. Do you have any idea what your family is going to need if you were to pass away?" And I said no. And he did the calculation, and I was blown away by how much insurance he said that I should have. And he said, "So do you want to start the process for insurance?" And I said to him, "Well, I don't intend on going anywhere anytime soon. So I think we can have this conversation another day." And it's the same thing. It's the same thing, right? I had said more than once that I don't have time to be sick. I knew that something was wrong. I was not feeling normal. Then I was not feeling well. And then I was feeling really bad. And, it's just like, I don't have time to be sick. And even earlier that year, I had been walking through a store. Excuse me. I had been walking through a store that had mugs, and one of the mugs that they had on the shelf was "Can't stop, won't stop." And I was like, "Oh, I need that mug." I need that mug because that was how I lived my life. Just there's no time for illness, there's no time for rest, there's no time for play. It's just do, 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 do. And that's what we're taught.
Yeah, absolutely. And especially as a woman, because you do your 9 to 5 and then you come home if you have children and
Mhm.
you've got another shift that starts.
Yeah. And don't forget, they'll guilt you on the way out the door while you are going to take care of your children.
Yeah,
Right?
yeah. And
Mm.
so do you think that there's a need to educate our healthcare workers? I mean, it's not like they don't know that there is a difference between men and women.
Yeah.
So, do you think that there is a need to educate our healthcare professionals on, like it's not just our hormones
Yeah.
like out of control, that there is actually something really wrong and we need to be heard?
Well, yeah, for sure. I mean, firstly, I would say that I think that obviously, women are women are a little bit better at expressing some emotions, and I think that that at times is seen as a negative thing, and I think that there needs to be an entire mindset shift that says that the expression of emotions is important and healthy. Because just because we express emotions doesn't mean that we also exude irrational behavior. And there seems to be this belief that expressing emotion equals irrational behavior, and it just doesn't. I would argue that people who don't express emotion do exude more irrational behaviors, in fact. And there are a million different examples that we could take a look at just over the last 4 years that, that would exemplify that, right? Right?
I can't
So,
think of any.
no, none at all. I am definitely being rational. So yeah, I mean, I think that there needs to be a holistic mindset shift in terms of expression, period. And there's some great information out there on that, especially in terms of how the suppression or repression of emotions impacts our health, which, I mean, I think we can safely assume at this point that there is some sort of link between emotional expression and physiological outcome. And something like 80% of people who experience autoimmune illness are women.
Mhm.
So yeah, I do. I think that this needs quite a lot of attention. And to be honest with you, I'm not entirely sure that it's all education. I think to your point, they know. Um, and so I think I wonder whether what the more important element in this is really um, more direct interaction with, right? More direct interaction and more maybe sensitization of humanity. I think that when you spend all day long, dealing with sick people and seeing hard things, I think it's natural that people would compartmentalize because they need to be able to function in a day too, right? And then if you throw on all of the administrative burden and political burden in the healthcare system, I can't imagine what that does to their stress level as well. And again, ultimately that needs to come out somewhere.
Yeah.
And I think under the circumstances, patients take a lot of that burden. And so I'm not sure that education in the traditional sense of teaching something is what the focus should be. I think the focus needs to be on resensitizing healthcare professionals and helping them, see people as people.
Yeah, and I wonder too, because and we discussed this just before we started recording about
Mhm.
how research is done on men
Mhm.
predominantly,
Yeah.
and so our understanding of women is just like women are a subtype of men, and this is our understanding of women, except that they have these
Mhm.
hormonal fluctuations that we don't
Yeah.
understand.
Yeah.
But the thing is that we do know that women's immune systems work differently than men's, women's brains work differently than men, our pain receptors work differently than men. And so it seems like there's some research being done, but it's not enough research. And so if we had
Yes.
like this full understanding and not just thinking of women as small men, then
Yep.
that I don't want to say conversation, but that interaction with the healthcare professional and the patient standing in
Mhm.
front of them would be a lot more natural than what it is now.
I think so. Yeah, I would agree. I mean, from a hormonal perspective, even from a pain management perspective, there's just seems to be this, what I think what's really interesting is that I have a female, I have had a female doctor for many years, And, I've had to go in for a number of procedures that, are not overly pleasant. And we've had conversations about procedures that aren't pleasant and stuff. And there is an awareness that these things are unpleasant and these things are painful. And, maybe there should be some kind of pain management included, but we never quite get into that because that's their training. They are trained that way, right? And they are obligated to draw the line somewhere. And so, even though they, as women, have an understanding of the necessity for things to be different, they themselves, because of their obligations, stop short of what they know we need,
Yeah. What they know they need.
what they know they need. Yeah.
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 I have an appointment with my family doctor later today, which
Hmm.
I'm dreading. She's a she.
Yeah.
And I've had a lot of health issues over the last like 3 or 4 years. And
Hmm.
it's to the point now where like I know she doesn't believe me, and
Yeah.
she's as much said so. And it's like
Yeah.
I know there's something wrong. Whether you figure it out, whether you can figure it out or you can't figure it out, I know that something is wrong. I don't feel the way I'm supposed to feel. And
Yes.
so all that to say is that I'm really dreading going to see her today.
You know what? I'll tell you, I just, throughout the course of my cancer treatment, there were many occasions where I felt like things weren't like things, I was not being heard. I felt like in some instances I wasn't being treated with the appropriate or safe care. And I felt like I wasn't being heard. And so I had to do a lot of pushing prior to my diagnosis and even after my diagnosis. I will say that my care hospital was incredible, incredible. But any of the supplementary treatments that I needed to go to, I never really felt safe in those environments. And those were the environments that I really had to push hard in. Um, and We shouldn't have to do that. We shouldn't have to do that when we're sick, right? But I think the unfortunate reality of things is that the patient doctor relationship has changed a lot, let's say in the last 20 years, right? I think historically, people would go to their doctor would tell them ABC. There was just like an inherent belief of whatever it is that the doctors say, you follow their orders and you're going to be A-okay. And that's not the relationship of doctors and patients now. I think that now family doctors almost act as like a almost like a mediator between between patients and other services, right? Your doctor will send you to a dermatologist. Your doctor will send you to a gynecologist. Your doctor doesn't really do as what they used to do, and so the relationship with patients and doctors have changed. But nobody said, "Hey, patients, you now have more responsibility in your care." And you need to ask more questions and you need to be sure of what it is that you do or don't do or whatever the case may be. So I also think that patients have a responsibility the current in the current climate to make sure that they're asking clarifying questions, to make sure that they are getting second opinions, to make sure that when something doesn't feel right, you have to push. And if you don't, it, we are the only ones who suffer if we
Yeah.
don't. So despite, in my own case where I was in cancer treatment and just put through the ringer really, and on a number of days had no energy at all, I still had to fight for my own well-being. And the only person who would have lost if I didn't was me.
Yeah. It's really frustrating. And I
Super.
mean, I think like when we talk about, cancer or whatever other chronic disease or even acute disease, I think like once you get to that diagnosis, there is a lot of self-advocacy that needs to happen, whether
Yes.
you're a man or a woman.
Yes.
What advice would you give other women in a similar situation?
Um, I think that I think that we need to do a better job of trusting ourselves.
Mm,
I think that I think we are taught to believe that we are the providers to all and we should backburner ourselves. And I feel like that is definitely changing, but there is a ton more work to be done there. I think that we need to recognize that if we are unwell, the things that we are managing can't possibly be well either, right? And I think that fundamentally, I mean, when you think logically, fundamentally, it doesn't make sense that you're going to be good at doing anything if you are not good yourself.
mhm.
And so I think that's what my advice to women would be is to pay attention to how you are feeling, pay attention to how you are doing, pay attention to your own needs, and really understand what your outlets are to manage stress or overwhelm or what do you need to recharge, what do you need to express, what do you need to be okay? Figure it out and do it as often as you need.
Yeah. And so I saw that you're sipping a mug. I'm assuming that's not your can't stop, won't stop mug. What does it
It
say
is
on your
not.
mug?
No, this is my good vibes
Oh, good
only,
for
but
this only.
don't come at me for toxic positivity. Everybody needs everybody needs to have a bad day once in a while too. But yeah, I think yeah, I that was the big shift for me when I was sick was that I immediately recognized that I was really living to I was really living to please others and really living to satisfy what other people wanted of me. And again, leading up to that illness was like, I can't be sick right now. I've got this to do. I've got that to do. And so you just push through and push through. And we treat that like a badge of honor, that we just keep
Yes.
going until we grind ourselves into the ground. And it is not a badge of honor. It is self-destructive, right? It's
Yeah.
self-destructive behavior. And so yeah, when I got sick and sat and really just reflected on my life and how I had been living, that was the light bulb moment for me. It was a real epiphany to say, you know, these are things that I've been doing in my life that don't actually serve me, and now what do I need to do to, you know, have a fulfilling, enjoyable, happy, calm life myself.
Yeah. And so for you, what has that been? What does that look like?
Oh, it has been a journey. It has been a journey. I'll tell you that. The first full day I was in the hospital, I sat there and thought, I'm not living the life that I should be living, and I need to do something about this. And I had no idea what that looked like at the time. And so it was very convenient, maybe is the word for it, when my oncologist approached me while I was still in treatment to say, hey, CHCH is coming in for an interview and they want me to bring a patient. Do you want to do an interview with me? And I thought to myself, well, I've spent my life terrified of speaking in front of people, so I'm not really sure how I feel about that, but hey, I may never get the opportunity to do it again, so let's do it. And that's really how I started, was doing campaigns with Canadian Cancer Society and Stand Up to Cancer and Leukemia and Lymphoma Society and stuff. And I just used that opportunity to network and figure out, where I belong in the healthcare space. And that has just kind of snowballed over the years to, the creation of an online support group for immunocompromised people in the face of COVID-19, and we're over 1,800 people around the world now who are supporting each other. And that turned into working with different industry partners on their patient experiences. And, and now I'm actually co-chairing the Canadian Immunocompromised Advocacy Network, which is working very much on similar things, I think, that you are in terms of, access to treatments and appropriate research, and inclusive research, and all of this just amazing stuff. So it's been this journey of 6 years of learning and growing and figuring it out, and ultimately focusing on patient experience and making a positive impact to improve patient outcomes that's my shining star.
Yeah. Do you want
Yeah.
to, if people want to connect with you on that online group that you mentioned?
Yes, for sure. The online group is called Immunocompromised People Are Not Expendable, and that is on Facebook.
Okay. And can people get involved with the Canadian Immunocompromised Advocacy Network?
Yes, thank you for asking. If anybody would like to get involved, they can visit us at www.immunocompromised.ca. There is a call to action page there where they can take a look at the different options and how it is that we're looking to connect with people.
Great. And I'll include that in the description for the video.
Thank you so much.
Well, thank you, Michelle. This, there are so many things that you said today that I'm gonna go back and think about, like, even for myself personally, like we do dismiss ourselves, and I'm so guilty of being one of those people, not anymore, but one of those people who is like, can't stop, won't stop. And it was I literally drove myself to the ground, to the point where now all the health issues started because of that. So
yeah. Well, I hope that you push back on your doctor and get what you need. Yeah.
Well, it's going to be fun. But thank you so much, and I'm sure that this won't be the one and only time we'll be able to have one of these discussions, and I look forward to talking to you more.
Me too. Thanks so much, Sabrina.
Thank you, Michelle.